Right, well, with COVID-19 aggravating an already severe hunger crisis in Zimbabwe, the United Nations World Food Programme has appealed for an additional $250 million to support a rapidly expanding emergency operation for millions at risk. WFP projections indicate that by year's end, the number of food insecure Zimbabweans will have surged by almost 50% to touch 8.6 million, a staggering 60% of the population, owing to combined effects of drought, economic recession, and the pandemic. A nationwide lockdown reinforced last week has precipitated massive joblessness in urban areas, while rural hunger is accelerating because now unemployed migrants are returning to their villages, and the absence of the vital remittance that they provided is more keenly felt. We're now joined via Skype by Lola Castro, who is the WFP's Regional Director for Southern Africa. A very good afternoon to you, Lola, and thank you so very much for joining us here on SABC News.
Good afternoon. How are you doing?
I'm very well.
Thank you for having us.
You're welcome. I'd like to begin, please, Lola, by talking about how really COVID-19 has aggravated an already fragile situation concerning hunger in Zimbabwe. I mean, we're hearing about the fact that, migrant workers who would have ordinarily been sending money perhaps to family who might have lost their jobs or, have had to be retrenched and so forth, are now in a difficult situation where they can neither feed themselves nor help to feed their own families. Talk to us about really how bad Zimbabwe's hunger crisis really is at this time.
Yeah, basically, as you very well said, the situation has aggravated. We had already a problem in Zimbabwe. The problem basically related to climate change. We have had several years of drought, very poor harvest, people unable to plant and to produce as much as they consume also for the market in the country. So the country was relying on imports of food, and World Food Programme have been supporting, also providing food assistance to millions of people last year and this year. Now, what happens this year is when COVID comes and the lockdown happens, we see a huge amount of professionals who are working in the surrounding countries who cannot work anymore and cannot send remittances. And we see an increment of food insecurity in the urban areas as well, because normally we see the rural areas which are more problematic and where we support more. Now the urban areas kick in, and we have also millions of people who in fact cannot access or cannot buy a minimum food basket because they don't have employment. They work on day-to-day basis. They are casual laborers, and there is no employment anymore. And that was the effect of the lockdown. Now, what we are seeing this year is quite dramatic, because normally the World Food Programme in Zimbabwe we'll stop our distributions of food or cash in June, and then we'll come back maybe in October, November, or December, even if the situation becomes bad again during the rainy season before the harvest. But this year is quite incredible. We ended our distributions in June to restart on the 1st of July. Yeah. And our plan was to provide support to 1.8 million people in July. Unfortunately, due to the lack of funding, we have been able to support only 700,000 of those 1.8 million in July. So really very dramatic what we are seeing at this moment.
Yeah, I'm just reading here an article where you've said that many Zimbabweans, Zimbabwean families are suffering from will be suffering from the ravages of acute hunger, and you've then appealed or called on the international community to step up to provide life-saving food assistance. How do you see this happening? I mean, sometimes we kind of see these visuals where these planes kind of come and drop maize on people, that kind of, I consider quite inhumane. How would you like to see this sort of crisis being averted, where the international community really steps up in a better way to provide food for what you've described as something that could become the ravages of acute hunger?
Basically, in Zimbabwe, we have a very good structure, and we work closely with the government, who also supports some of the people who are food insecure in the country. We don't fly planes unless, for example, last year during the Idai cyclone, when it hit the Chimanimani mountains, the Chimanimani and Chipinge districts were affected and there was no access. So we sent helicopters and we provided food through helicopters there. But normally in Zimbabwe, what we do is we buy in the countries around like South Africa, Malawi, Zambia, Tanzania, and we bring the food in through the normal corridors, through the different corridors, road and train if required. So that works very well. But basically what we need now is the funds early enough, because we are now trying to buy in the region. There is enough food in the region this year, and we are lucky because by having the food in the region, we can save money from transport to bring food from international markets. We prefer to buy locally and regionally, and then move it to Zimbabwe early enough so that we can access all these people on time. Because if we're not on time, basically the problem is we will have malnutrition, we'll see children deteriorating, we'll see the community selling their small assets. Maybe they have a chicken or a goat or something, they will sell it to be able to feed themselves, and then they will have nothing for the future. So it's very important to preserve the small resilience these communities have and support them, as well as the urban area.
Is there real sort of encouragement really coming from the WFP on not just relying on the international community to provide funds and so forth, but as you've mentioned, to kind of, it's better to teach someone how to fish, isn't it? But in this case, most of these people are farmers in any case, do know how to farm in any case. Is there a real sort of encouragement really that they produce most of their own food in any case, as they might be able to do so, and perhaps that's where the kind of assistance should be really sort of coming in?
Yeah, for us, World Food Program, our objective is to make people being able to feed themselves all the time. So we have been working with many communities in Zimbabwe, and I want to recall, I was recently in Masvingo area, very affected by drought, and we visited these communities where they have done a dam. So they had water the whole year. Even when there was a drought, they had reserve of water for the animals, for the gardens, for the fields, for small animals. So these people were becoming already resilient. So this is what we like to continue doing, to make sure that people have access to seeds, to fertilizer, to small animals, to water, and they can feed themselves all the time. Now, the urban population related to COVID is a bit more complicated, because that is related to employment. And if employment is not there, or remittances are not there, these people will have a bigger problem. So this is where World Food Program comes in with cash transfers. So we provide them a minimum cash transfers, like this is the social protection that will help them to overcome this crisis and be able to maintain themselves. But basically, the situation is critical. We really are seeing that by the end of the year, as you very well said, we need to be feeding or providing cash transfers to around 8.6 million people, but we will reach probably only around 5 million. That will be the most emergency and in crisis ones. The others will be taken care by the other agencies, government, and other actors.
All right, Lola, pleasure speaking to you. Thank you indeed for giving us your time this afternoon on SABC News. That's Lola Castro, WFP's Regional Director for Southern Africa. Thank you. Yeah. All right, that's our discussion.
Thank you for your interest.
You're welcome. You're welcome. That's our discussion then on the hunger crisis set to hit Zimbabwe anytime soon. All right, it is 2 minutes past